Alhamdulillah, salatu wassalamu ala Rasulullah wa ala alihi wa sahbihi ajma'in. Amma ba'd, Assalamualaikum warahmatullahi ta'ala wabarakatuh. Today we're going to talk about some of the equipment used in the musculoskeletal system, specifically when they do surgeries in the orthopedics department. So I asked my friend here, Dr. J.R. Alvia, he is a medical officer for of the Department of Orthopedics, to prepare this presentation. So I hope I'll be able to give justice to this presentation. So when you conduct surgeries, kasi one of the most important things that you need to do is to ensure that the patient is fully sedated, meaning katulog siya and the patient is relaxed. Because you really can't operate on a awake patient. At the same time, you don't want to operate on a tense patient. It would be more difficult surgically and technically, no, to operate on individuals like this. So the anesthesia machine, aside from the skill of the surgeon, the skill of the anesthesiologist is also very important, and the machines that they use are also equally important. So itong anesthesia machine began in 1917. So prior to that, there have been forms of anesthesia that has been administered, injections, So they were before they let them just drink alcohol and they just go into an alcoholic stupor and then they operate. But as we go on, of course, naging mas sophisticated ang delivery of anesthetic drugs and gases. So in 1917, si Henry Boyle, he is of course an anesthesiologist, developed the continuous flow anesthetic machine, or they call it the Boyle's machine. So this is very important because that helped revolutionize the way that we anesthetize our patients. So your assignment would be to look at what are the typical points and the typical parts of the anesthetic machine, and identify its electrical components and the principles. But most importantly, what we want to find out, if you can find it, is how do modern machines prevent overdose? Because these equipment keep on delivering. So how do they ensure? Is it merely the presence of the anesthesiologist who's looking at it, or are they built-in safeguards in the equipment that ensure that the patient does not get more than what is needed? Prior to surgery also, you need to be able to have sterilization of equipment. What do we mean by sterilization? Basically, sterilization is to ensure that the equipment is free from bacteria and viruses and all the other contaminants. Very important ito because once you do surgery on a patient, you basically open up the body of the patient and expose the inner parts of our patient to any infectious substances. Now, the skin is a protective element of our body. So when you open that up, you are actually really allowing bacteria and viruses to enter. So dapat ang equipment that you're using should be clean and sterilized. So there are two ways. The first way is to use heat and pressure to sterilize. So this is called the autoclave machine. No? The autoclave machine is used to sterilize veterinary and of course human instruments and other procedures. Okay, so your assignment would be to look at the parts of a typical anesthetic machine and its electrical components and the engineering and scientific principles applied to its operation. How do they kill? Basically, how do they kill the viruses? Now we're going to look at the cold sterile tray. So this is another way to use, and we just use chemicals. Now one of the things that typically we use this for is for sharps, no, yung mga scissors, scalpels, and our needles, because the heat destroys the edge. So this one preserves it, but it is also, syempre, also tedious, no? So tedious. So I'm not gonna ask you to identify the chemicals, but needless to say, we do have chemicals that can be used to sterilize and kill bacteria. One of the machines that used during surgery, well, in the preparation for surgery, is to look at the blood status. So one of the ways that we use is to have our blood centrifuge, so we'll be able to count the blood components. And it's also used for urine, no? But in terms of surgery, it's usually in the blood. No? So this is a machine that uses uh, what do you call that, the force to separate. I think we've already discussed this in the previous study, in the previous lecture. So basically, this is a review again of the parts of the centrifuge, the components, and the principles applied to its operation. We go to a little bit more in depth, and we're going to talk about arthroscopy. So arthroscopy actually comes from the Greek word arthro, meaning joint, and scopen, meaning to look. So basically, what you want to is you will look uh, into the joint, but it's not like you're gonna open it, no? But it is through a small hole. So ano siya, more fine, precise, and more finesse in looking at. You don't split open the whole muscle and bone to be able to look inside. So what are the arthroscopy machines? So equipment and assemblies. So you have your TV monitor. You're connected to that, so you'll be able to look at that. You have to have power, a light source. You have the cable, no? You have the cable and a camera. And kasama na dito yung irrigation fluid bags and the connectors because you want to ensure that the blood is removed and you're siphoning out all of those, what do you call that? Parang things that are inside. Sometimes there's pus, sometimes there's blood, sometimes there's serous fluid, so you need to remove them at the same time suction them out. Okay, so this is the monitor, no? So this is where you look at when you're doing the arthroscopy. And this is the one that projects what's inside the camera. So the camera head, this is the one that's called the brains of the equipment. So you attach this, and then this is the one that's producing the image. No, it's a very, shall we say, high tech na rin kasi because it's it's very small, the hole, yet it's able to actually generate an image on the screen. So you also need to sterilize this, no, oxide gas or hydrogen peroxide gas. So kailangan pa rin, even if it might not go into contact, but bacteria might be able to migrate through the arthroscopy tube and into the knee. Now, pag bacteria goes into the knee, it would be very rapid, the destruction of the joints, and it's an emergency for us. So this is an example of the camera head here attached to the arthroscope. So you can actually just attach it. Now, light is also a very important aspect. No? So you really need to have a light source for this to illuminate the inside. Siyempre, it would be dark. There's no light inside. Okay, so usually we use xenon or LED in the light source kasi LED wala siyang heat, no. You can also use gas, no, sterilized. So light cables should always be sterilized because again, all of this equipment, if you need to really ensure that they are sterilized well, you are gaining access into the substance of the body, into the inner works of the body, and you are actually bypassing the defense mechanism. And then, so this is your light source, the arthroscope, and the camera head. So, na-attach na nila. Notice the hand there, no, is actually gloved. And if you look at here in the next image, you will see that the person actually naka-gown, this is, you're doing it in a controlled environment, usually in the operating room, and in such a way na there is really, your air is clean, the doors are clean, the tables are clean, and then the patient is wrapped, draped very well. If you look at the leg, you see the brownish coloration. It means that this patient has always also been, the skin has been sterilized with betadine solution because you really want to ensure, because bacteria can live on the skin as well. So we shave, and then we sterilize, and then using aseptic technique, and then that's when you can do the puncture. And even though sometimes ganyan, no, even if it's adequately prepared, we still give we still give antibiotics, oral antibiotics to prevent, especially if you're considering that this patient has, like for example, an infection in the joint. So you still need to give. Okay. Now we look at bone drills and twist drills. No? So, syempre, the bone is very dense. No? So it's really hard for people to insert. Like there's some bones that are broken, so you need to put screws. You need to drill, no, into the hole. So you put screws, nails, etc. We use a lot of this actually, and this is one of the most requested kasi madali din siya masira. So there's an electric drill, no? It's very easy to use. You also have your manual drill, no? So ito kahit saan pwede mong dalhin. But the thing is, it does not have it's a little bit difficult to do as well kasi syempre manual power ba. And maganda dun sa electrical is syempre you can control it very well. Here, it depends on your strength, and if it's a difficult surgery, it will be a little difficult for you to manipulate this. So this is a cannulated power drill. So ito naman, it's not connected to a power source, but it has a battery. So you've seen a lot of this. No, we have power tools in the house where they have batteries, but again, has a finite life cycle because of the batteries. But this is a good trade-off between the fully powered and the manual is to have this battery operated. So here's an example of the bone drill being used. So you can see the drill being the bone being drilled, and then you're putting in your nail, you're putting your plate, so that there'll be support. So this very common operation right now, this using of bone drills, because there's a lot of cases of us having children or young people on motorcycles having accidents. So guys, if you drive motorcycles, please be careful because once your leg is broken, sometimes well, not only is it painful, but sometimes it's difficult to put them all together again, because especially if they're shattered. So we use a lot of plates, a lot of screws, and it's difficult, and the recovery is very long. So please drive safely, drive defensively. The laryngoscope is used to insert, no, help insert tubes. So we also do this in surgery, so especially for those who have inhaled anesthesia, like yung sa Boyle's machine, no? So you need to have, kasi it's gases, it has to go straight to the lungs. So you need to insert a tube into the lungs. So we use the laryngoscope. Okay. So this one here, may battery siya. When you snap it, there's a light source that comes out and allows you to see. So it's a special field as well. Magagaling dyan ang anesthesiologists to do that. But internists can easily do this as well. So yung bone raspatory, sometimes when you have fractured bones, no, they are actually very, very sharp. And so you need to actually file them down. Parang file ito siya eh. So rasp down. Yun. So kasi if you are sharp edges, it might actually puncture the blood vessel or the muscle, causing further injury. So you need to prevent that. And finally, some procedures sometimes you do it under radiology assisted, no? Like for example, biopsies, sometimes CT scan guided. So you're doing a CT scan at the same time you're getting samples. So you need to wear protection. So these shirts, they look like sort of like gowns, no? Merong lead yan. So it protects you from that. Yan. So those are some, not all, of the things that equipments and stuff that we use when you do orthopedic surgeries. So thank you very much, and thank you very much to Dr. J.R. Alvilla.